Okay, think back to the last time that you had the common cold or flu, and the symptoms probably lasted about like a week and then it went away. That's because here in America we have ample opportunities with medicine and doctors and being able to get treated. But what if I were to tell you that in other countries people are dying daily because they're catching the common cold and flu and they don't have any medicine, so they're dying? My topic is donating to the nonprofit organization Doctors Without Borders. According to the article, Child Mortality Updated in September 2011 by the Women's Health Organization, over 9 million children under the age of 5 die every year from preventable diseases. This means that 750,000 kids under the age of 5 are dying every month. That means 25,000 a day. This means on average 17 an hour. This statistic is only children under the age of 5, so imagine how many people of all ages are dying from preventable diseases. These conditions can be prevented and treated with access to ample, affordable intervention that your donations can help aid. I've researched the organization Doctors Without Borders and learned about all the different ways that my money and your money can help save lives. I want to convince you to donate or to volunteer fundraising by showing you the need for health intervention in developing countries, by telling you about how Doctors Without Borders reaches people in need, and by telling you how your donations can help save lives. Medicine and doctors are needed in developing countries to help people recover from sickness, disease, injury, and malnutrition. An article written on January 13th, 2015 called "The Leading Cause of Death in Developing Countries" might surprise you on the website NZIA. I learned that the leading cause of death in poor countries is pollution, and 8.4 out of 9 million people were killed by pollution worldwide in 2012. This article also states that pollution isn't what kills people. Instead, it causes heart disease, chest infections, cancers, respiratory diseases, and diarrhea, all of which are curable with access to medicine and doctors. So now that you know what the problem is, what can be done about it? People in impoverished countries are dying so rapidly from the curable diseases due to the fact that they have no access to medicine or doctors, and Doctors Without Borders gives these people hope to recovery and to living a longer, healthier life. Doctors Without Borders' mission is to help people worldwide where the need is the greatest, delivering emergency medical aid to people affected by conflict, epidemics, disasters, or exclusion from healthcare. According to the History and Principles video published on September 28, 2016 on the Doctors Without Borders website, 33,000 staff are on the ground in roughly 70 countries. Also, the Doctors Without Borders website says that more than 10 million people's lives were saved in 2014 across the world due to the attention and care of the Doctors Without Borders medical staff team. The Doctors Without Borders website also tells us that there's not only doctors and staff providing impoverished sick people with medical attention and care, but they also offer these people love, companionship, and hope to the people who may not receive that. And let's talk about how Doctors Without Borders uses money from donations to help save lives. According to the Doctors Without Borders website mentioned earlier, the Doctors Without Borders team has developed ready-made kits to help them mobilize quickly. These kits contain the materials needed to fight certain outbreaks or get a surgical program up and running. A kit may even contain a fully functioning inflatable operating theater. The vast majority of Doctors Without Benefits funding comes from private donors, not the government. So what can you do to help? Your donation of money or your time fundraising for Doctors Without Borders can save numerous lives a day. To donate, you can visit the Doctors Without Borders website, or you can give in other ways, such as donating stock gifts, tribute giving in memory of someone or to commemorate a holiday, or you can donate by mail. You can also give with your time by street fundraising or taking part in the combined federal campaign. You've been presented with the need for doctors and medicine in impoverished countries, what Doctors Without Borders is, and how you can take part in helping Doctors Without Borders. You have the power in your hands to save countless lives of children, men, and women who are dying daily. Help give the gift of life to people who deserve to live a happy, healthy life.